Hello, everyone. Please rise for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. All right, so welcome to the January Board of Health meeting for City of Revere. I'm Dr. Drew Bunker, chairperson, and with me tonight is Kathleen Savage, board member to my left, and Viviana Catano, board member to my right. Also is Lauren Buck, who's director of public health, Michael Wells, who's health agent and director of inspectional services, and Paula Sepulveda, who's the board of health clerk. First thing we're going to do is review and approve the minutes from our last meeting, which is actually October 24th, 2024. So I ask the other board members to approve those minutes.
I approve the minutes.
I approve of the minutes.
Great, thank you. Next is going to be the Public Health Communicable Monthly Report with Lauren Buck.
Thanks, Dr. Bunker. Okay. So our monthly report is for actually two months worth of data. So you'll see that our influenza number from October 24th, 2024 to yesterday was 307. So that's, quite a few, a very large number, but it does reflect more than just 1 month of data. And it is respiratory illness season, so we were, expect to see higher numbers. Our coronavirus number is 118 confirmed and 33 probable. We did have one Mpox case in our city over the last 2 months. And then finally, our public health updates. Over the last few months, national news has been reporting regularly on the current avian flu, which is called H5N1. While the current risk to the public remains quite low, the CDC is watching the situation carefully and working with states to monitor people with animal exposure. The current avian flu is common in wild birds worldwide and is causing outbreaks in poultry and U.S. dairy cows. As a reminder, Revere's urban agriculture ordinance does allow for small backyard flocks of chickens to be kept with an up-to-date license from the Board of Health. Anyone with chickens or poultry in their yards needs to take appropriate precautions to reduce the risk of transmission of the avian flu from wild birds. So please reach out to the Board of Health at 781-485-8486 if you have any further questions or if you are aware of any backyard chickens in your neighborhood. Thanks.
Great, thank you. Next is the Inspectional Services Monthly Report with Michael Wells.
Thanks, Dr. Bunker. Inspectional Services Report for the month of January. On the Interior Housing Division, we performed Certificate of Fitness. We issued 46. Certificate of Fitness re-inspections, 13. Interior complaints, 21. And interior complaint re-inspections, we had 2. On the Food Inspection Division, number of routine inspections was 27. Number of re-inspections was 7. Number of complaint inspections was 3, and 1 pre-opening inspection. On the Exterior Sanitation Division, violations issued, accumulation of litter, trash, garbage, and debris, 22. Carts out at improper times, 3. Commercial vehicles in residential neighborhoods, 1. Overflowing dumpsters, 29. Improper placement of garbage, trash, and bulky items, 186. And improper storage of garbage and trash was 8. Junk heaps and automobile graveyards, 1. And multiple unregistered vehicles on the property was 1. And snow, ice, and sump pump violations is 34. I'd like to just take a second to speak about snow, ice, and sump pumps. We're obviously in that season where snow is upon us, and it is up to the residents and business owners to clear their sidewalks on the front and side of their properties to at least create space for a stroller or a wheelchair to get by on their property. Also, sump pumps, please ensure that they're not discharging onto city sidewalks and streets, causing ice buildup and a nuisance. Thank you.
Great, thank you, Michael. Next is going to be the MAPC presentation. I'll ask our representative to come up. Oh yes, and Revere TV, do you mind putting up the presentation, the slideshow? Thank you.
Good evening, and I want to say my thanks to the board for the chance to be on your agenda this evening. I really appreciate it. My name is Barry Keppard. I'm the director of the Public Health Department at the Metropolitan Area Planning Council, but also in that role, I am part of the team that supports the North Suffolk Public Health Collaborative, and that's what brings me here this evening. I'll provide a little bit of a background on the North Suffolk Public Health Collaborative, how it involves Revere, then talk a little bit about some of the work that's coming out of the group that's happening, but then also talk a little bit about some proposed changes that essentially would involve the board, and so that's a big reason of why I'm here this evening too. And also just want to give my appreciation to your public health director, health and human services director, Lauren Buck, who's been really a big part of the work there and really helped with a lot of this. So the North Suffolk Public Health Collaborative, you can go to the next slide if you want, Paul. Thanks. The North Suffolk Public Health Collaborative was formed in 2016, and it formed when an intermunicipal agreement or an IMA was signed between the city of Revere, the city of Chelsea, and the town of Winthrop. Just really highlight two main reasons for the formation of the North Suffolk Public Health Collaborative. Chelsea, Revere, and Winthrop, Revere among it, is a place where essentially kind of residents experience a higher amount of chronic disease and other kind of places than in Massachusetts too. And so as a way of thinking about how to address and look for opportunity to improve essentially kind of wellness, well-being, and essentially kind of reduce those risks of people essentially having kind of worse conditions or more illness in their lives, the collaborative was formed. The other part of it too is that we're at a part in time in Massachusetts where that ability to kind of demonstrate kind of a larger population of impact to do things collaboratively is really being incentivized. And so it was an opportunity for the three municipalities to work together. When they came together, the collaborative has a board that's formed by the three executives of each of the municipalities. So in the case of Revere, that would be the mayor who would serve on the board there. But what it's allowed us to do is actually, sorry, I'll have you go to the next slide. I'll go one more slide. And then what that's essentially allowed the formation of the collaborative to do is to essentially be able to kind of bring shared staff to Revere that also works with Chelsea and with Winthrop. And that's really recognizing that there are additional capabilities in terms of like skills, knowledge base, expertise in the public health field that can be valuable to local public health departments, but it can be really a burden at the municipal level if everybody has to hire that position. So there's a way to kind of efficiently do that by hiring positions in a shared manner. And what that's resulted in for Revere and the North Suffolk Public Health Collaborative is capabilities from MAPC on the public health side. And then even more specifically, there's now a shared public health nurse that works across the region. And there's also a shared regional epidemiologist. And in both those roles, they're kind of doing additional support around communicable disease, ways essentially to kind of increase the ability to vaccinations. There's been an incredible effort around childhood vaccination that was really kind of spurred by and in Revere, so really to make sure people were in a place that they could be protected and grow up healthy. And then even more so essentially to do that work, really to think about what's the evidence, what are the changes to create more healthy environments. So I'll pause there just for a moment just to see if there's any other background or clarifications I can talk about the collaborative. I'm going to talk a little bit more about what's coming up, but just wanted to pause and see if there's any background that would be helpful for the board. All right, I'll go one more slide. And just really want to highlight, really again, some of the things that this work has contributed to. I spoke a little bit about kind of the staffing and the service level. What I would add here is that now, and we're kind of in our third cycle of this, of being able to do a community health assessment and improvement plan for Revere, and that's being done essentially at and through the city level. Often this is something that might be done only by a hospital, and I think as you can imagine, sometimes the priorities don't always reflect what a particular community holds. And so in this particular case, it's being done essentially through Revere, Chelsea, and Winthrop. One of the things that by having the collaborative, it actually positioned the city very early on in the pandemic to be able to benefit from state and federal resources that were flowing down. And that's because the three municipalities were working together. And so it became a really great place to direct that funding. And that's not in any way to talk about or suggest that essentially the municipality didn't make significant investments as well in that response, but we're able to kind of bring state funding as well too as that. And then as I mentioned again too, there's kind of expertise we can turn to, as Lauren was talking about with the avian flu, as we kind of look and learn that research, we have somebody like our epidemiologist we can turn to directly to be able to supplement that information that can be helpful at a local level. I'm gonna go one more slide. So the changes that are in front of us now for the collaborative, much of it results to a funding stream we're receiving from the state from a program called the Public Health Excellence Fund. And this is essentially trying to make sure that every city and town public health department is meeting essentially the kind of state statutes around public health protections and services, but also essentially kind of doing it in a way that essentially kind of brings in and involves boards of health. So the IMA that I mentioned earlier is going to be revised, and that'll go through each city and town for review and approval before anything is signed. But the one change that is essentially in there is Board of Health involvement. And right now, there isn't necessarily a Board of Health member on that, and we'll be looking to offer essentially that representation on the board as part of it. What we're also doing at the moment too, and again, really have to appreciate the time that your public health staff, including Mike, have provided to this, essentially showing that there is compliance with the public health laws. There is the first time in the last couple of years where the state actually put all that in one place. And you would be probably not surprised to know the number of statutes and regulations that are meant to be met. Some might be antiquated, but a lot essentially kind of still are in place. And so we're working to do that. In addition, there is actually a new state law that was passed that's essentially kind of setting standards for essentially kind of the credentials that public health staff should have if they're doing certain work. So you can imagine when you have people who are essentially doing things that are engineering or architectural related, they often have to have a certain essentially kind of background or licensure to that. That same type of change is coming down. And it's being supported by training and other investments, but that's coming down too. And then lastly, as I mentioned, there'll be a 2025 community health assessment that'll be wrapping up in the near future. So I'm gonna stop there and again check, but just really wanted to check with you all in terms of that background, but essentially get any thoughts and kind of increase your awareness around some of the changes that are expected to come down for the collaborative.
Sorry, so where do you guys get your funding from?
Sure. So initially when the collaborative was formed, each of the municipalities made an investment in the collaborative. At this point, it's actually coming through the state grant, which is the Public Health Excellence Grant. And so we have there's something called the Shared Service Coordinator role to help organize, and that's where the funding comes from now.
Barry, can I ask a question?
Please. Yeah.
Can you explain more what you mean by Board of Health representation?
Sure. So with essentially the Public Health Excellence Fund, with the grant, there are decisions that need to be made in terms of positions, investments, budget over a year, not probably unlike things that come before you now. But what the IMA will be updated to say is that a Board of Health member from Chelsea, from Revere, from Winthrop will come together and help in that decision-making across the collaborative. So we'd be asking for time of a board member, maybe 4 times a year, to be able to be part of those conversations in addition to any kind of communications in between. But that would essentially kind of constitute a public meeting where you'd come out and be part of that decision-making for the collaborative.
Sorry, so you work directly with North Suffolk, because North Suffolk in my mind is mental health
So
group, but yeah.
Thank you. Sorry, I didn't mean to interrupt you. Yeah, so there is again, I don't have the name correctly too, but North Suffolk Mental Health I know has a new name now too. And so really that's speaking to the geography of where that work is happening. And so then the North Suffolk Public Health Collaborative reflects that same geography, but is essentially directly related to the local public health work in each of the municipalities. So on the public health side, yeah. Separate, exactly, yeah. Thanks for the chance to clarify. All right. So I guess just to top it off there too, thank you again for the time tonight too, and probably through Lauren, but maybe even through myself directly too, we'll be following up with you to let you know about those changes, essentially as that's kind of moving along, as any kind of final decisions are being made, but as I mentioned, probably following up to see if we can get representation from the board on essentially the collaboratives board as well.
Excellent. Thank you very much.
Thank you so much. Thank you for the time on your agenda. I appreciate it.
All right, and then next is going to be the licensing renewals of body art. That's going to be Lauren. Go ahead over.
So it's the time of year again when we do all of our body art inspections for the renewal of their licenses. There are 16 license renewals that I'm gonna run through. I'll run through all of them. They've all passed our inspection. They all are getting recommended by myself and Mike to be approved by all of you. So I'll just run through all of them and maybe we can do one big vote so we don't have to do all of them. So The first is Janet Aesthetics. She's on 270 Broadway. Her inspection was in January. Sorry, I don't have the exact date for her inspection, but she did pass. So she has 2 licenses for the establishment and for her individual practitioner, which is Janet Izquierdo. Katia Elisabo Micropigmentation is on 91 Hutchinson Street. Her inspection was on January 22nd, and she passed. She also has 2 licenses for the establishment and for herself, Katia Elisabo. Babe and Beau Spa on 475 Broadway. Their inspection was on January 21st. They passed. There's 3 licenses that we're asking you to approve tonight. First for the establishment of Babe and Beau Spa, then for 2 individual practitioners, Feng Luang and Shelley Vu. The next, there's Lakshmi Beauty, which is 100 Shirley Ave, C1. 2 licenses, their inspection was December 12th, 2024. They did pass. So the establishment license for Lakshmi Beauty passed, and Blanca E. Soto Lenis, which is the individual practitioner who practices there. Next, Sarah Espino Studio is on 510 Broadway. Her inspection was on January 16th for 3 licenses: the establishment of Sarah Espino Studio, the individual practitioner license of Sarah Espino, and the individual practitioner license of Henry Arazo. They all passed. Next is Brow by Camilla. She's on 655 Beach Street. Her inspection was on January 17th. For 2 licenses, the establishment of Brows by Camilla and the individual practitioner license of Maria Jimenez, and they both passed. And finally, Cat Beauty Co. on 207 Squire Road. The inspection was on December 12th, 2024, for 2 licenses for the establishment of Cat Beauty Co. and the individual practitioner license of Catherine Piguro, and they both passed. So we're recommending all of those licenses be approved by the board.
Yes, I approve those licenses and ask the other board members.
I approve also of the licenses.
I approve of the licenses as well.
Great, those are 3 approvals. Excellent, so now we'll just open up the meeting to the public if anyone has anything to say. Okay, well, that will conclude this month's Board of Health meeting. Thank you.